we are live. All right, good morning, INSURE Black America. How are you? How are you this beautiful Tuesday morning? Okay, and so let's go ahead, let's jump right into it. So, how can health insurance, how is that income protection, right? And you might think, oh, well, no brainer, but a lot of people don't know how you having health insurance can really help you in the long run when it comes to building wealth, and taking building wealth to leave your legacy to take care of your family. Okay. And so, in this live video today, that's what I'm going to be talking about. I'm going to give you two reasons, two to three, why health insurance equals income protection, okay? And so, for those that don't know me, you don't know who I am, my name is Katrice-Daniels. I am a licensed health insurance broker. I am licensed in 9 states, and I am also the founder of INSURE Black America, where my mission is to close the coverage gap in healthcare between Black Americans and other racial groups. Because as it stands now, Black people are least likely to have some type of health insurance when we go, to seek out care. So that's a gap that we need to close, and that's my mission, is to close that gap. Alrighty. And so health insurance equals income protection. Well, the first reason and the most obvious reason is that health insurance, it saves, it reduces your out-of-pocket cost. Okay. And so if you've watched me, if you've listened to any of my videos on YouTube, INSURE Black America on YouTube, I always say this: when you go to the doctor or when you go to the hospital, whatever have you, if the bill is $20,000 and you have no insurance, you owe the whole $20,000. So that is $20,000 that is coming out of your household. Okay. You can't do, you have to, you don't have to, because a lot of people don't pay their medical bills, but that's a whole nother topic. But that's money coming out of your household. When you have health insurance, and if your out-of-pocket maximum is, say, $85.50, all you're going to pay is $85.50, right? So you can pay $20,000 or you can pay $85.50. Which would you choose? I would hope you would choose the $85.50, because then you can take the rest of that money. That's money that's still in your household that you don't have to, that's not coming out of your household. And, your medical bills, you can still afford your medical bills because you got insurance. All you're paying is $85.50. And then the other $11,000, you know what I'm saying, you can use that for other things like investing. Having health insurance allows you to not pay so much on your health care costs. So you can take that money that you're not spending on health care costs and you can invest. You can invest in Forex. If you don't know what Forex is and you on Facebook, somebody somewhere on your timeline, I'm sure, has said something about Forex. Invest in Forex. You can invest in stocks. I follow Dr. Boris Watkins, and he has the Black Business School, and he always talks about investing. He talks about even on Cash App, because even I did it. He talked about it, and I wanted to see how it works. And you can take $5, $10, $15, $20, $50. It's not a whole lot, and you can invest in stocks on Cash App. Because I got Amazon. Christmas coming up. Amazon finna blow up. And so I got a little bit of stock in Amazon, and I'm going to get some more. And it's simple, it's easy, and you know what I'm saying? You can take that money that you're not spending on healthcare costs, and you can invest. You can also save that money. There's different savings products out there you can get with a financial planner, a financial advisor, I mean. And, they can help you to show you how to invest in other, other savings. There's mutual funds. There's all kinds of stuff. And I'm not a finance person. So, I don't know. I can't direct you in the best, where to go, but you can invest. You can get with somebody who knows, and you can invest. And then also, you can take that from your savings. You can invest in real estate. That's another way that you can build wealth. That by having insurance, because you're not putting so much of your money into your healthcare costs, you can take that other money. You can save some. See, just go get you a piece of land, buy you some land, have you some land in your name, and then you can build on that land if you want, or you can pass that land down. That's what my daddy did. My daddy, he bought, he had, got pieces of land, and he passed land. When my daddy died, he left us houses, and he left us some land. And so, like, that's one thing having health insurance can do for you, is to help you to not have to spend so much money on going to the doctor and buying medications and all of that type of stuff, to where you can take that money you're saving and you can invest it in other areas, and you can build wealth for your family. Because at the end of the day, we're not here just to live here and just to, just to enjoy, life. We are also here to leave a legacy for our children and our children's children and our children's children's children, and so on and so on. You know, other races do it. Other races do it. They make sure that they leave something for their children besides debt. Like, they don't even, debt is not something that they're not thinking about leaving their children debt. They're thinking about leaving their children wealth. They are thinking about setting their children up on the path to wealth. And that is a mindset that we as Black people, we need to adopt that mindset as well. You know, and I think it's coming. I think it's changing as far as how Black people think. I think especially the year 2020, this year, and with the elections and the pandemic and everything that has been going on, I really think that for Black people, I can only speak for Black people because I'm Black. I don't know about other races, and what their thought process was this year, but I know for Black people, this has been a real eye-opening year for us to say, hey, what we've been doing has not been working. GoFundMe's, they don't work. Just going to the emergency room just to get acute care, but not getting follow-up care, it does not work. And so these are things that we need to start changing now, moving forward. Okay, we need to start changing this narrative of just living in the now, and we need to start thinking forward. We need to start coming up with a 5-year plan, a 10-year plan, a 20-year plan for our families, and not just for our families, but as a community and in whole for Black people. We need to come up with a plan to be able to better our community 5 years from now, 10 years from now, 20, 30 years from now. But it all starts with what you do now, and what you can do now to benefit not only just you, but also your family in the future, is to make sure you have proper health insurance, get life insurance. You know, most people have auto insurance, but for those that don't, get auto insurance. Like, what insurance is something that protects your pocket. And so, that's the main goal, is to protect your pocket. If I can pay $85.50 versus $20,000, if I get sick and go in the hospital, I'm gonna choose that 85.50, and I'm saving $11,000. So, that's what I have for you guys today. if you did find value in this live, please share it out so that others may find value as well. Also, if you have not liked Insure Black America, if you have not liked the page, go ahead and like the page. You know, more people need to hear about health insurance. Right now, the open enrollment period for the health insurance marketplace, or Obamacare, and the Medicare annual enrollment period is now open. Now is the time that you need to be making your elections for 2021. If you have not done so, you need to go ahead and get that done now. I know Thanksgiving is coming up on Thursday, and you know it's a little modified, a little different this year, but you know people are still trying to get ready for that. Okay, you definitely don't want to wait around to take care of your health care election for next year. So if you need some help with that, if you have questions, issues, concerns, comments, you need some help with that, you can schedule your free health needs assessment with me at www.insureblackamerica.com. So you guys have a great rest of your Tuesday. I will talk to you later. Take care. God bless.